Hi, my name is Shelby Redfield Kilgore, and I'm the filmmaker and creator of all these videos on this YouTube channel about adoption and about my cancer journey during the pandemic. And I just wanted to say thank you so much for watching my story, and I hope that you will like, comment, and subscribe. It's the best way to support my work. And I hope you will share with your friends, family, and community. You never know who this might help. I am really glad that I had the energy to kick out this third episode in my cancer journey in time for October, which is Breast Cancer Awareness. And so I really hope that this will be shared widely to get the word out. And without further ado, I will let my episode play. And if you are new to my story, I hope you will go back to the first episode when I first was diagnosed right after the pandemic hit. Today is March 31st, 2021, and it marks a year since I felt a lump in my right breast, and so began my journey of battling breast cancer. My name is Shelby, and I was diagnosed with stage 3 breast cancer on April 17th, 2020, amidst the coronavirus. I had wanted to really document this whole process, the bilateral mastectomy and the lymph node removal and then the radiation therapy, but I didn't have the energy because I didn't realize I also had to go to occupational therapy for 2 months as well, and I didn't realize I would have such an issue and hard time with my right arm because of lymph node removal. I wasn't aware. I mean, I was told that I may need to get it, the occupational therapy. I was told that I may be at risk for lymphedema, but it did not register what that meant and what that looked like and how that would affect me if that were the case. So I didn't mentally prepare for it. So it was very, very hard for me to accept that and to process all of it, how hard it has been. And I knew I would have to wait to try and document this through an interview because I just don't want to cry through the whole interview. Before my surgery, I was so stressed out because apparently when I went for pre-testing before my surgery, which was a week before, where they had to draw blood and they had to check my EKG. Apparently there was something abnormal that the breast specialist noticed on the EKG. So she's like, you have to see have your primary care physician look at this. And I'm like, I don't have one, and I've tried to get one, but because of this virus, no one is taking new patients. And so she found me a cardiologist, and I had to go see a cardiologist really quickly, so that I didn't have to delay the major surgery I was having on October 22nd. And, everything was fine. He was like, this is actually pretty normal with my EKG. But at first I'm like, oh my gosh, now is there something wrong with my heart? Can anything go right or smoothly? And he said that because of the chemo that I was on, it can affect my heart, because I was on adriamycin and cyclophosphamide for 2 months, and then I was on paclitaxel for the other 3 months. But the adriamycin and cyclophosphamide, the AC, is what could affect my heart. So apparently I have to keep an eye on that every 6 months and see a cardiologist. So tell me, what was going through your head when you were driving me to the hospital for my bilateral mastectomy?
So when I was driving to the hospital, I was just, well, it's weird to say, I wasn't too worried.
Why?
I mean, I trust the hospital, I trust the process.
Mm-hmm.
So, I mean, it's because what I do for a living, I know in the back of my head there's always a chance, but I trust that it's going to work most of the time, and I had faith it was going to be all right.
I had to wait about an hour and a half before they called me in, and I had to change into a gown. And I hate needles and IVs, and they had to, of course, put an IV in me to start administering the pain or the whatever medication that will help me be knocked out. And then also I had to get a nerve block as well in my, I guess it was in my back is what they did. And that's the last thing I remember is signing paperwork from my breast specialist and my plastic surgeon, getting an IV and the nerve block. And then I passed out. And the next thing, I wake up on the stretcher being moved to a room, and I am in so much pain, and I feel like my chest is caving into my lungs. And my body has always been so sensitive to medication of any kind that it just wasn't responding to the morphine that they gave me. Like, I threw up twice. I wasn't able to hold down any water or food of any sorts. They tried a different, I believe it was some sort of Oxycontin through the IV. That didn't work either. I threw that up as well. It was just horrific. And they tried dilaudid next. That did not work either. Like, I was still nauseous and in tons of pain.
So how you feeling?
6 or 7.
Is that out of 10 pain?
Yeah.
When I first saw you coming out of the procedure into the ICU, well, I felt all right. You looked like a wreck. You.
I'm gonna cry.
You're a little looked a little messed up, but I mean, I hate bringing this back to this, but I'm used to seeing people in this condition, so I knew that this was a temporary state for you. You looked rough because you just got a major surgery, but you would recover. Everything would be fine.
I felt absolutely horrible and miserable.
You looked like you felt miserable.
Out of my mind in misery.
You were not looking happy.
Are you feeling good? Are you feeling happy, safe, comfortable?
My breast really hurt.
Yeah.
I thought it wouldn't. I thought they took all the nerves though. No?
And you still probably feel where the nerves were.
So it's phantom. So they put a tube down my throat.
Is that why you're so scratchy sounding?
I don't know. When will I find out if it's a dead cancer or tumor?
They probably have to biopsy and study it.
What do they say? It's you.
Just that everything went fine and you're doing well. We'll get all the details tomorrow.
Okay.
Let's try to smile for the...
No.
You don't want to try to smile?
My arms are hurt too.
And my husband, you know, he came to visit me when he was allowed to, and he took some pictures of me. And there's this one picture where I'm trying so hard to smile, and every time I see that picture, I start crying. because it brings up everything I was feeling at that moment. Like the pain, the excruciating pain I was in, the nausea, the emotional aspect to everything that was happening to me, that I had lost parts of my body, that I would have these scars for the rest of my life across my chest. I was just so miserable, and I was just trying to hold onto some shred of light, of hope, just to get me through that moment in time that I was going through.
I'll try and eat a cracker.
And the next morning, I was not able to get discharged because I still could not hold down water or food. And that was disappointing, but also I didn't want to go home yet because I knew that there's no way they could send me home because I was still in so much pain. And you know, the nurse, like around the clock, they have to give you medication like every 4 to 6 hours and check on you and make sure you go to the restroom. It was like the first time I had to have someone help me go to the restroom, and it's just it's just not a good feeling. So I had to stay another night, and what happened was, because they removed all the lymph nodes under my right arm, I was no longer able to get an IV or blood drawn from my right side, my right arm. So they had put the IV into my left hand, and I didn't really think too much of it, but it was starting to slightly hurt as they put medicine in, or IV fluids actually, because I couldn't hold down water, like drinking it normally. And I just kind of just let it go because I also didn't want them to have to stick me again because it's so painful, and it's annoying to find my veins because apparently I have tiny veins, so it's kind of hard for them to find them and for it to work.
So apparently you are a difficult stick. And the second night, one of the IVs had infiltrated and your arm started puffing up. Mm-hmm. It was just a little frustrating. Had to switch up the meds because you didn't want to suffer through waiting for a nurse who can get an IV in you.
Mm-hmm. Yeah, they had to blindly stick me like here, right? Was it here or was it here? I think it was here. I don't know. But it didn't work. I think they blindly stuck me like twice before the breast specialist said that I could go to oral meds instead of intravenous. So when I came home that Saturday, because the surgery was on a Thursday, I pretty much just laid in bed. I was very hunched over. It's what my plastic surgeon said would probably happen, like just because of the pain.
When I took you home, I was mostly concerned about you making it up the stairs into the apartment. You were a little wobbly. Mm-hmm. Then we got you home and got you into the bed with your crazy contraption to help you sit up, and mm-hmm. got you comfortable, and that was about all I could do at the moment. I'm just happy you're out of there and safe at home.
My brother, he came for about a week to help care for me while my husband still had to work that week, and he took me to all of these doctor's appointments I had to go to, which was to the plastic surgeon. I had to go see my oncologist. I had to see my breast specialist. It was just a lot. What was it like emptying my drains? They were so disgusting. I was so thankful that you were able to do that for me, because I sure couldn't. And then, my brother came for a week to help, and that was not something he could have done, but glad again that Travis, could handle it.
So, emptying the drains, not an issue.
So gross.
Again, I'm used to bodily fluids and fluids with little chunks of fat and viscera in them.
Ooh. One of the things that you have to do as part of your recovery is you have like these drains that are attached to you because like fluid and stuff has to be ejected from your body from the surgery. Can you explain like what the purpose of these drains are for?
So you had a couple drains in. You had the wound vacs on that had the constant suction, that had a battery pack that I had to make sure was working fine because every now and again it would suck some air out to create the vacuum for the healing of the chest wounds. And then you also had the JP drains in that would drain fluid buildup on the inside that I had to drain and measure twice a day on both sides. And I mean, doing pacemakers, I'm sucking up fluid with chunks of fat and blood and stuff all the time. So it's just I don't know, just looked at it as another task.
Can you tell me when you first saw me without all of the bandages, like what that was like for you?
It was a little rough seeing you for the first time without the bandages. I mean, I pretty much mentally prepared myself.
Did you know what it would look like? You'd seen pictures. Yeah, I had to do that too.
So I was prepared. I mean, it still was not easy.
No, it's still not.
But it was something I knew I'd have to deal with and handle, so just kind of tuck it down and go forward.
I just did not prepare myself mentally that I would need to go to physical and occupational therapy because I did not realize like I would have limited movement in both arms, but especially my right arm from the lymph node removal. And what happened to me was, it doesn't happen to everyone, but I got cording, which is where like the lining over your muscle gets wrapped, entangled with like the scar tissue or something like that is what it was explained to me. And so every time like I would raise my arm, like there's this like big pull across my whole right side of my chest into my arm. And so I couldn't like drive for over a month because I couldn't reach higher than this at times. And also for radiation therapy, I didn't know like the position that I would need to be in. Like lying on my back, I would have to have my arms raised behind my head and my elbows like leaning against the side. So I couldn't even pass the radiation simulation when I was supposed to start radiation therapy because my arms were so limited in movement. My plastic surgeon gave me a referral to get physical therapy 3 times a week for 8 weeks. And the first appointment that I had was in November. And I remember the physical therapist, when she was having me do like different stretches or kind of to see where my range was at, which was very, very limited for both of my arms, but especially my right arm. I said, is it normal for people to faint from the pain of these stretches? And her eyes got really, really big, and she's like, no. And I'm thinking, okay, because I feel like I'm going to faint. And I wasn't being dramatic or anything like that. I really, really felt lightheaded, and that like this pain was just unbearable from these stretches. And so after I left, she called my a plastic surgeon, and I was given a script for occupational therapy. And I'm so grateful for that. I had an occupational therapist for the 8 weeks where I went 2 times a week, Monday, Wednesdays usually, and then Fridays is when I saw the physical therapist. It was probably the only treatment that I went through that I have fond memories of. I could see the improvement every week with how far my arm could go up or to stretch. And that was actually really helpful for my headspace as far as being more positive. I also feel like it was the only time where I actually talked to people, because I've been so cooped up in this tiny apartment because of this pandemic, and incredibly afraid to go out in public in general. And so it was just nice to talk to someone, and someone who I felt like understood me, both of them. And yeah, so it just was something to look forward to, even though it was like bright and early in the morning, because I made it so it was before my work day, because the only way I could compartmentalize was to have my doctor's appointments in the morning and then work during the rest of the day. So it was hard when I had a doctor's appointment in the middle of the day and it was maybe emotional or something like that. But yeah, at least occupational therapy was in the was in the morning. What was that like, seeing me not be able to like put on clothes? Because I couldn't like use my right arm barely.
I mean, I'm pretty used to you being helpless, so.
Well, yeah, lately when I was on chemo and stuff. Hey, I still worked through chemo, and a week after my surgery, I'm a pretty tough cookie.
Yeah. I knew it was going to happen. I knew you were going to have limited mobility, so just kind of helping you and encouraging you along until you could dress yourself.
When I finally got my arms in the right position for the radiation therapy, which was a big help from my work with the occupational therapist in the beginning, it was like they were my own little cheerleaders, cheering me on. And so that felt really, really good to have that kind of support, because I failed the first time. And then finally, when I was able to pass the radiation simulation and get a bunch of pictures taken and scans done, because of my expanders that have been filled with saline over a couple of weeks, so that I would be ready for when I'm able to have the reconstructive surgery months later. I had to get another simulation after they told me that I had to get the saline removed, because the geometry of how they were going to target the radiation kept hitting my left side. And I'm like, what? Because when I went to the plastic surgery place to get the saline removed so that I could start my radiation therapy as soon as I could, the PA, the physician's assistant, said this has never happened to them before. They've never had to do this before. So I'm like, once again, I can never go through something at this point and it's supposed to go the way it's supposed to go. Having to deal with all of that was a huge headache and a lot of frustration and a lot of tears. Radiation therapy was not easy. I had to go 5 times a week for 6 weeks, and it was in the winter time, so there were snowstorms, and we're from Florida. I can drive in torrential rain like fine, but like a snowstorm, icy roads, that's not something I am familiar with at all. So that made me nervous, having to drive. Well, in the beginning, because I couldn't drive because of my arms, like I was taking an Uber, and that scared me because of this virus. So I was wearing a ton of protective gear, 2 masks, safety goggles over my face, But then as soon as I was able to start driving again, I did. But it was also stressful because of all the snow, and we had 2 snowstorms during that time. But I made it through, and I didn't miss a day. At least with radiation therapy, it's like 10 to 15 minutes for each session, so it's not too long. It's very uncomfortable. I mean, in the very beginning, my arms were so stiff from being in that position for that long, but it got a little bit better as, the weeks passed. Radiation therapy made me very, very tired and a little bit of nausea, but mostly just a lot of fatigue. And I had to put this skin remedy cream on like 3 or 4 times a day. You can't do it, I think, a couple hours before before the radiation therapy. But I was really diligent about that because I had seen pictures where like the burns from the radiation therapy is so severe. It's like you can get sores, like open sores from it. So I wanted to make sure I could avoid that if possible, and I did. So I just got like really, really tan in that area. And then of course, after radiation therapy, my skin started to peel. The radiation therapy was all during Christmas and New Year's, and I remember lying there with my upper body exposed for the radiation therapy with the scars, and like they're playing Christmas music, and I just always thought to myself, I really don't want to associate some of my favorite Christmas songs with radiation therapy. And it was hard to like try and drown it out. It was also hard to realize like I have been going through treatment for over 6 months at that point. And it was hard sometimes not to cry. I had to choke back tears many a time. Over Thanksgiving break, I finally read the book that was given to me by another cancer buddy. It was written by Amy Robach, and she wrote a memoir about her journey with breast cancer, and she is pretty well-known like news anchor, TV personality. And I remember crying a lot during her descriptions of when she talked about waiting at the doctor's office or staying overnight at the hospital. She kept talking about how she had like the support with her. Her husband got to stay overnight at the hospital with her. She had a friend come wait with her when she first was diagnosed until her husband could come after work. And I just remember breaking down into tears because I grieved that loss, that I didn't have that kind of support. Like during this crazy upside down world we live in of this pandemic, of this virus, I had to go to most of my doctor's appointments alone. I had to go to chemo all alone. And then at the hospital, my husband, like, he could visit, but he could not stay overnight. And I think that's a reason why, like, I wasn't able to cover as much as I would like filming wise of this journey so far after my chemo, because it's been that much harder for me to get through all of this. When January comes around and my husband gets vaccinated and my occupational therapist and physical therapist get vaccinated, I'm so happy, you know, for them. Because what a relief having to come to work and, you know, risk being exposed to the virus every single day is incredibly scary. And then finally for me, on March 23rd, 2021, I got my first vaccination, Moderna. And I remember like getting the email saying that I was allowed to sign up, and I was jumping for joy, because I'll tell you, being terrified of getting this virus has been really, really stressful and somewhat debilitating for me. It's scary to go outside, other than to go to my doctor's appointments or to go on a walk with my dog. My husband drove me, waited in line outside, but then when I had to go into the gym, he couldn't come in with me. I felt frightened because I was like the only Asian in the gym. And the week before, the Atlanta massage spa shootings happened in Georgia. So I was really just scared in general. I was realizing that I was looking for exits and I was looking for places to hide in case, you know, we're just also exposed in a gym. And I felt like this is so crazy that I'm thinking of where to hide and where the exits are. It's just too much for me to like really digest and believe that all of this craziness is happening. And anyhow, I was just glad I got the first vaccine, and my arm, that was pretty much my only reaction, was my left arm got really, really sore for a couple of days, and I got a terrible headache and was really tired. But yeah, I can't wait to get my second vaccination, and then I'll be fully vaccinated, and I'll feel better about going on, hopefully, errands to just the grocery store and maybe even the mall if I want to go. Yeah, I'll just feel like I have a lot more freedom, which will be great. The bilateral mastectomy, the lymph node removal, not being really mentally prepared for all of that. Like, I tried, but I guess I just didn't think it would be as hard as it was. I didn't understand, it didn't register what being at risk for lymphedema meant for the rest of my life, that my arm could puff up and that I would have to go to the hospital immediately, that when I fly, I'll have to wear an arm compression band to try and prevent it from becoming lymphedema, that I have this chronic illness, the acceptance that I will never feel the same, my body will never feel the same, losing body parts. Having to go through like all of this during the holidays too, like Thanksgiving and Christmas and New Year's Eve. That was really, really hard. So I I didn't film a lot because I was so emotional. And even though I was working, I was really good at still compartmentalizing for the most part, where I'd have most of my doctor's appointments in the mornings. And I would go to I work remotely, so there was nowhere to go to except walk from my bedroom to the office. And yeah, so I was able to like cry in the mornings and then work throughout the day. And I was grateful to have a job for most of that time because it kept me busy. And I feel like if I didn't have that, I would have just been in a really deep depression, because all I would have was, battling this cancer through all of this treatment. It has been the hardest year of my entire life, and it's not over yet. I still have a major surgery on June 15th, 2021, which is a couple months from now, and it'll be the reconstructive surgery, which will be the DIEP flap, where they will take some of my fat to use instead of silicone to fill me, and it'll be probably 4 nights at the hospital as I recover, and to make sure my body doesn't reject it. And I'm pretty terrified of this surgery because of how horrible the bilateral mastectomy and lymph node removal was, and how my recovery was for that. I feel like it's been incredibly traumatic for me. So I'm just trying to mentally prepare for this next surgery and the recovery that will follow. How have you been able to keep, for the most part, a pretty positive attitude?
I don't really know. I'm able to just keep a positive attitude. I have no other choice.
I have to remind myself daily what I'm grateful for. Do you do that?
Not really. I don't know. I just live in the moment and know I have to be positive, because if I'm not, it'll all come crashing down.
Well, it is June 15th, 2021, and it is 5:20 a.m. in the morning, and I am on my way to my second surgery, the reconstruction and the DIEP flap, and hopefully also the port removal. And it has taken me 2 weeks of a lot of tests, scans, blood work, doctor's appointments for me to be cleared. And I have had a therapist for 7 weeks now, and that has been really helping me with my anxiety. So I am trying to be very positive that the surgery will go smoothly and my recovery won't be as traumatic as my first surgery. I am about to go in for pre-op for my second major surgery. I'm very nervous, scared, tired, sad, just frightened of the second surgery, but I hope for the best, and I hope it's goes smoothly. And Travis can't even go into the pre-op with me because of this pandemic, which is crazy, because the first surgery he was able to go at least wait with me, and so now we're going to be separated. But I'm not going to get full of anxiety. I'm going to try really hard not to. And so here I go. recall, you know, when I first got out, because it, again, like the first surgery was hard for them to get me to wake up, so they had to like punch or push a ton of medications into me, and I woke up, and the first thing I tried to scream was Travis's name, my husband, and then I was like, oh, thank goodness I'm alive. And then the scariest feeling, I feel like I'm suffocating, I can't breathe, and you know, trying to communicate that when no sound is coming out of your voice as you're screaming, you know, I can't breathe, was, I think, one of the most terrifying things I have ever experienced. And you know, they lifted my head up like this, and then I could breathe, and then when they let go, my head would fall back like this, and then I couldn't breathe. Like there was no oxygen going to my head, my brain, and my arms were, I was trying like to move any part of my body that would listen to my, you know, what I wanted it to do, and so my arms started like flapping, and I remember hearing the voice of one of the people who I couldn't see in my memories, like of recollecting this experience. It was very much like a nightmarish dream, and a bit of a haze, and darkness around. Faces were hazy. I couldn't see them, but their voices were clear, and it's like I saw very little. And I heard someone say she's seizing, and I'm thinking in my head, no, I can't breathe. I'm just trying to let you know. I am trying to signal that something's really wrong. And I remember asking the nurse, who I don't recall what she looked like. Again, it was very dark in this memory I'm recalling, and I said, can you please stay with me? And she's like, yep, I'll be right here next to you. And I just remember telling her where I was feeling pain, and that was really tough for me. And that Travis couldn't be there. I couldn't hear his voice. That was hard. And I only got to see him in the hallway for a few seconds as they rolled me to the recovery area. So I had to go up to pre-op on my own, and they stuck me twice and weren't able to find an IV, and then they ended up having to knock me out with the nerve block in the back first, along with accessing my port that I still had that was planning to be removed for the surgery, to give other things to help reduce pain, I think, and also knock me out. And then they put 2 IVs in, and the surgery was 13 hours long. So they ended up having to pump all of these fluids in me, check the pulse to make sure the blood flow was good every hour for about 48 hours, maybe even more. And I didn't get any sleep. I couldn't. I was writhing in pain, and the intense nausea, very much like from my bilateral mastectomy. And what happened was I started bleeding the following day, which was Wednesday and Thursday, like in the incision sites where the drains are for your fluids that you have to have in for 1 week to 2 weeks, sometimes even longer for other people. And that was concerning to me, but the doctor said that was pretty normal after a long surgery like this. And then I started feeling really, really dizzy Wednesday night and Thursday, and it was terrible. Like, I would get the worst dizzy spells, worse than when I was on chemo, and I felt like I was going to die. And I was very communicative and vocal about every time I felt something was wrong with me, because this was incredibly scary. It still is. And when I found out about the dizziness, because they take your blood every morning besides your vital signs and give you Herceptin, a blood thinner, and you're on all of these other more medications, and you wean yourself off as you can based on your pain level, you know, to lower levels of pain medication. Basically, Friday morning was when my blood work was done again, and my hemoglobin levels were very low, like 6.5, and the physician's assistant told me no, it would take like months, you know, to try and do it a different way other than a blood transfusion. So they had to come draw more blood to confirm what blood type I am, which I found out I'm B positive. I mean, I feel like the blood donors out there are lifesavers, and I am so grateful, you know, for this person's blood. You know, I was stressed out before getting it on Friday, the blood transfusion, because the 2 IVs in my hand that were put in during the surgery started burning, and that's not normal, because basically your whole hand and arm will puff up, which happened to me for my bilateral mastectomy. So I didn't want that to happen, so I told our nurse immediately, and so they had to find another vein, and my veins have just been incredibly tricky to work with, and so I have been poked and prodded and stabbed so many times. My anxiety levels get really high when this has to continue happening, and but the nurse was able to get the PIC unit, and they have like this ultrasound that finds the vein for you, and so they got it on the first try, and I was like, thank goodness. And it worked, and so I had to have 2 bags of blood, and that was transfused over the course of like 7 hours, I think, and I was starting to feel better that evening, and my head was starting to clear, the dizziness was starting to fade, and that was a good sign.
This is day 4 in the hospital, right, Travis? Yeah, day 4. I had to get my first blood transfusion, and that was scary, but I felt like it saved my life. So thank you to the B positive donor.
And then at 3 a.m. in the morning, I woke up gagging because of this metallic taste in my mouth, and it scared me so much because I had never experienced this intense smell and taste. And I told the nurse, you know, every time like I tell my concerns about what's happening with me, they're all so calm, and so that was helpful to keep my anxiety levels down, because I'm sure they've seen like everything in the book or have heard everything, and so they know when certain symptoms are probably not concerning and which ones are. So we figured it was probably like they had to give me a lot of magnesium on Wednesday, and because after they drew my blood, I was low on magnesium, and so I was like, maybe that did it, or maybe it was also the flush, the nurse said, that goes with the blood transfusion. Some people have expressed like that they actually taste and smell that, so I'm thinking maybe that's just it, and it'll just be expelled out of my body hopefully soon, because it makes food taste terrible. And on day 5, I've started finally being able to eat solids, like larger meals, not just a few bites of something.
Been a while.
My mom and my stepfather Rick came to visit me, and it was the first time I had seen her in person in a year and a half because of this pandemic. I was still out of my mind and in pain and dizziness, so I couldn't even really enjoy the moment of seeing her. They're gonna stay with me for
4 weeks, or helped take care of me for 4 weeks, and I'm so grateful for that. My dear friend Naw and Tim came to see me at the hospital, and I've known them since I had my first job after college at a TV production company in Orlando, and Naw was so sweet to stay 3 days and come see me every day. And that meant a lot, and I had so much support from all my other close friends and my parents and my brother, and my therapist sent me flowers, a card, and ice cream, and my husband, of course, who's always been my rock through all of this. So I definitely had a lot of that. Definitely had some great support. No one going through what I'm going through could do this without support, for sure. They tell you to try and stand up straight. That's hard.
You did it.
Is today Friday?
Today's Friday.
Oh yeah. This is very hard. I need help. Well, today is June 20th. It is the 6th day of my stay at the hospital, and this morning when the physician's assistant looked at my chest, she noticed swelling in my left chest area, and that could be a sign that blood is pumping in but not necessarily going out. And so after she showed photos of it to the plastic surgeon, she told me that I needed to go back into the operating room, and my anxiety skyrocketed. But I tempered it and tried to keep it under control. I called or texted my therapist if she could talk soon or now, and she was wonderful and said yes. She was driving somewhere, but she pulled over to talk with me for a few minutes and started to go over some breathing, mindful exercises, and that was very helpful. I think the reason why I felt so scared and anxious and fearful is because I felt like I don't want to go through the recovery I just am going through now from the surgery on Tuesday, and I'm terrified of anesthesia because the last 2 times it's been difficult for them to wake me up. It's taken a long time, and they have to push a lot of medicines out. And so, yeah, that's, I think, the big reason I'm terrified. I'm frightened of dying, and I have so much more life to live and so many dreams and goals and that I want to do. And so many people that I love in this life. I will say that I am so incredibly thankful for the medical care that I'm receiving. The anesthesiologist was very comforting about, what she was going to do. She even gave me this anti-nausea medication because I just have so much nausea after anesthesia, and it takes so much longer than most other people to get out of my system, and I'm miserable. And so far it seems to work. It's been about like 4 or 5 hours since my surgery, so it's a good amount of time that normally it would be very, very nauseous. But I have had an appetite and some energy, so It was a very simple surgery, and I am so relieved for that. And while they just went in to see if there was bleeding or blockage, there was no bleeding, so they left it as is, and they're trying to see if in a few days maybe it will work. Maybe the blood vessels will connect in a way that the blood flow will go in and out normally in a healthy way. And so that's my hope. I'm having these positive thoughts that it will go that way. And yeah, otherwise, if it doesn't work, the plan is to put an implant in the left breast. So I'm also, prepared for that, but sending positive thoughts to the flap working, the way it was intended to. Well, today is day 9 of being in the hospital after my surgery on June 15th and having a secondary surgery this past Sunday. And I'm hoping tomorrow, once the physician's assistant and the plastic surgeon check my left breast, that it hasn't swollen any larger. Every day the physician's assistant has come in since every day since my surgery on June 15th to check, and she says once they notice the swelling on Sunday morning that or at least the physician's assistant hasn't seen it growing any larger, so it's possible that the veins and everything is working as far as the blood flow well, and that's my hope. So I hope that tomorrow, which is Thursday, that I will just be discharged. And just preparing too, if I do need to go into a third surgery in less than 2 weeks, for them to put an implant in. But I really hope that I don't have to have a foreign object put into my body. That was the whole goal with doing the DIEP flap surgery. To curb my anxiety, I read a book yesterday because my mind is very alert. So I've been journaling to help process my feelings. I have been doing a lot of guided meditations and breathing exercises. At night, I listen to beach waves. That helps to kind of drown out the noise as well outside in the hallways of all the other nurses, if there's cleaning going on, because it's really hard to get any kind of sleep at the hospital. Also because they check you for vitals every couple of hours. They drain my drains, because I have 4 of them right now, 2 on the hip and 2 up by the 2 breasts, and yeah, it's been a lot. I think processing this almost 2 weeks and the recovery, the aftermath, it'll take a while for my brain, my emotions to catch up. Today is day 10 of my stay at the JFK Hospital in Edison, New Jersey, and I just found out that I don't have to get my 3rd surgery, that the flap survived, and I'm really excited to get out of here finally. So it's been really good news for this morning. Finally, some good news after this week and a half of torture. That's all I have to say. I'll get out of here soon. Today is Saturday, September 25th, 2021, and it has been over 3 months since my second major surgery, which was on June 15th. And just to give a quick update, after I was discharged from the hospital 10 days after the surgery because of the complications that happened, because I was only supposed to be in the hospital for about 4 days and 3 nights. I was so fortunate to have my mom and my stepfather there. They came up from Florida to help take care of me for 3 weeks, and it made all the difference. They took me to all of my doctor's appointments because I had to go a few times a week to get checked up on, and they did errands for me and went grocery shopping and fed me, and it made my recovery a lot more manageable, easier, I guess, which I'm so grateful for. It was much more peaceful, I guess, actually would be more of the word for it. I was still in tons of pain, and emotionally it was very, very hard for me, but I had all the support that I really needed. My husband was there, and my brother came to visit for a few days, and one of my best friends, Deanna, came, and then of course all of the gifts and cards and flowers and phone calls and texts and all of that really helped me keep my mind off of things sometimes, and meant so much to me. And you know, my recovery, I'm still recovering. I feel like I'm still recovering from my first surgery in last October, for my bilateral mastectomy and lymph node removal, because of the cording that I'm still dealing with. So I don't have the full range of motion in my right arm. And so that's always frustrating, but you know, I'm continuing to go to occupational therapy, and I'm seeing some improvements, and I really enjoy my occupational therapist who specializes with breast cancer patients and those that are at risk for lymphedema. And I've also been able to continue working. I am so grateful to keep my mind busy, and because I'm fairly young, I'm gonna be coming up to 38 soon. That's what all the doctors say. Like, if you're able to work, because you know it's important to get back into some semblance of a normal lifestyle. That's very hard to do for any of us right now during this pandemic. It's an upside down world, and but yeah, I've been so grateful to stay busy. And you know, so many people tell me like they can't believe that I'm working during all of this treatment. It's now been 1.5 years since I was diagnosed with stage 3 breast cancer, and I've been able to work through most of it. But I tell them that I feel like if I didn't have a job, I would be in a really deep state of depression, because all I would be thinking about is what's been happening to me, and my emotional brain or whatnot like can't handle that. I don't think that anyone could handle like thinking about what's been happening to you all this time, because it's very traumatic, and it's been very difficult for me emotionally on weekends sometimes when I have the quietness to sit in what I've really been going through. And I continue to journal, and covering my journey, my cancer journey, has also been a way of processing and dealing with what's been going on, and it's very therapeutic in ways. Sometimes it can be triggering, but just rewatching the material that I film and my own interviews, you know, the initial first time that I rewatch stuff is hard. It's very triggering, but it helps me relive some moments that maybe I didn't really want to think about. And as I keep watching it, it gets a little bit easier each time, because that's sort of my goal, is that I hope that when I do see things that remind me or trigger the traumatic moments of this journey so far that I won't be later on in life, you know? I feel that there's so many similarities with my adoption trauma and those triggers. It's all very similar to what I'm going through now with the trauma from my cancer journey. And I think that has made me a lot more resilient and able to cope as well as I have so far. And also just the support that I have. Like, my husband has been steadfast in his support for me and his love for me. He truly is my rock. And we have our dog that I love so much. And I have the best family and friends. I have had so much support, and I don't know how anyone could go through what I'm going through without that kind of support. One of the things that has been a bit difficult for me is when I had my first surgery, the bilateral mastectomy, back in October. They did, check the mass that was removed to see if the cancer was dead from the chemotherapy. And there was still residual cancer. So it made me hesitant to say, like, what you see on social media from all these people surviving breast cancer or cancer, saying that they're cancer-free. So I have never really said that because what that means that there was still residual cancer, like they removed everything that was visible, but I still could have cells floating around that are abnormal that could still be activated. And so that's always like a thought back in my mind about the cancer returning, and that's terrifying. And so I guess it's more appropriate for me to say the cancer is in remission, since I am BRCA2 positive and I estrogen positive as well. That's what feeds the cancer. I will be on medications for several years. I'll be on an estrogen blocker called letrozole, and I have to get this painful shot once a month called Zoladex, and that's for ovarian suppression. And recently I just started on lynparza. It's a fairly new drug that a new study came out this past summer that showed very promising results that it would prevent the cancer from returning for patients that are BRCA1, BRCA2 positive. So the lynparza that I started on recently, the side effects have been for me so far is severe fatigue and slight nausea. And the first 2 weeks were really hard as my body got used to it. And then the side effects started to subside a little bit, but it's still pretty consistent now, the level. But it's bearable. I'm still able to work and function pretty well. But it's just some days it's harder than others. Like, I'm very tired of having to be on medication. And the estrogen blocker and the letrozole, they give me side effects as well, which is fatigue and also hot flashes. And also there's long-term effects, which it hurts my bone density. So I have to get checked to make sure like that's okay. And for the rest of my life, there's been long-term effects from the chemo, which could affect my heart, so I have to see a cardiologist every 6 months. And I also have to make sure that I keep an eye that I don't get ovarian cancer as well. So I have to see a gynecologist every 6 months and an gynecologist as well. And I it's tiring when you really think about it, and I'm doing my best to try and live in the moment, to live in the present, as my therapists always tell me. And just some days I give myself the ability to be upset because that's pretty normal. It's a really it's really unfair what happened to me, and it's really, really hard what I have to go through and continue to go through. So my next, hopefully last surgery for a while, is going to be October 19th, and that's to finish up reconstructive surgery. And then I hope my next and last big surgery will be when I get my ovaries removed in 5 years. Well, maybe 6 years, because first my husband and I, after I'm able to stop taking all of these drugs, the letrozole and the ovarian suppression will be for 5 years, and the lynparza for 1 year. So after I'm able to stop taking those safely, then my husband and I will hopefully try to start our own family and have children if I'm able to. I wish I had been able to catch this earlier than stage 3. If it had not spread to my lymph node under my right arm, I feel like my treatment wouldn't have been as rigorous as it has been, or aggressive. And so that's why early detection, I think, is so vital and important. I think what happened to me this past year and a half, all of the physical trauma to my body and the emotional trauma is catching up to that. And so I want to make sure that I continue to process everything that's going on. Every day I remind myself how grateful that I am alive. You know, I remember when I was first diagnosed with stage 3 breast cancer, I remember being terrified of dying young. And that fear still is lingering in the back of my head. You know, I feel like I've gotten through so much, and so that fear is much diminished now. I feel like I have a long life ahead of me. And a lot of that, I feel, is because of the medical treatment that I've received. I'm so grateful for all of the doctors and nurses and techs that have taken care of me and continue to have played a part in saving my life. In reflecting on the past year and a half, I have gone through so much on this cancer journey, and I am just relieved that I have been able to get to the point where I am. I can hopefully start really getting back to more of a normal life. I mean, as normal as it can be during this pandemic. And I am grateful to all of those that have watched my journey, and I hope that my story is helpful to you and to others. I know that I am not alone in my journey. I know other people are going through something similar, and I know that it's even that much harder going through something like this during a pandemic. And so I hope for everyone that is going through what I'm going through, that you'll come out on the other side like I have.